Hi, my name is Liz Lundry. Thank you for joining this webinar hosted by Stella Life. I'm going to be talking about the oral systemic link today. And as we're joining the call, I hope that you're all using the link sent in your invitation and are looking at this on a computer screen so you're able to actually see the PowerPoint and not just hear the voice. So please do that if you can. And also, please mute your lines. That would be greatly appreciated. And at the end of the presentation, you will get your code for your CE Zoom units. And we will also have questions and answers after the presentation. So there's an option, if you're on your computer, to actually submit questions with a chat option, and we'll go over them, but we will also take live questions after we're done, okay? So I'll let me tell you about who I am and what we'll be discussing. I am a practicing hygienist. I do still see patients in a practice in Walnut Creek, California, and I've been a practicing hygienist since 1979. And since 1988, I've been a trainer with the JP Institute. And at the JP Institute, we go all over North America into dental practices, and we provide continuing education units and implement programs to fulfill the vision of the doctor and the team for what they want to have in their practice. So we're able to get everybody on the same page and get the clinical results to go to a whole other level. We help with practice management issues as well as integrating high-level technologies like lasers, refining ultrasonic and other technology. If a doctor wants to implement wellness and nutrition in the practice or Botox and facial aesthetics, we help with that. But we go into offices. We've been doing this for over 3 decades, and I've had so much experience meeting so many clinicians, and I am a clinician myself. So I know your world. It is my world. And together with JP and with all the doctors and hygienists and team members we've worked with, through webinars and study clubs and in their offices, we're able to, as a mission, help implement programs to better our patients' overall health, not just their oral health. And today we'll be talking about that connection in more detail. So we're going to talk about periodontal pathogens. We're going to discuss ways that we can get better healing and how we can do this with reducing pain without having to depend on opioids for our patients, and how we can enhance the healing with our patients so they can be comfortable and also have long-term better health. So we will go over treatment planning, how to integrate some advanced technologies, and also innovative systems that are natural that are going to promote healing without any negative side effects for our patients. And it's, again, all about communication with our patients and communication with each other so we can be truly effective. So as we look at periodontal disease, we're going to talk about the definition, the mouth-body connection, and other details of risk assessment for better treatment planning. So we all know that periodontal disease is an inflammatory disease of the supporting structures of the teeth caused by bacteria, viruses, microorganisms that cause the destruction of the gingival tissue and the supporting structures of the teeth. How common is it? You know, as you look at different studies, you'll see different percentages of how much of the population is actually affected. But the question that I ask the clinician as I travel around North America is, how many patients can you see in a day or a week? Where hygienists, you do a prophy, assistants, doctors, you do a crown prep, and you don't see any bleeding when you are treating your patients. And the response I get is generally, well, I can pretty much count them on one hand within a week. A lot of rolling eyes and sighs, because that's how it is. The reality is most of our patients have some bleeding. And I personally feel that it's important to me and all of us to be on a mission to eliminate that, because we're learning that even a little bit of bleeding has a huge impact on the patient's health. So the cause of periodontal disease, we know, are pathogens. It's a bacterial biofilm invasion of the tissue. So we have a localized infection And as this infection is progressing, and right from the beginning, it stimulates the inflammatory mediators, and the body goes to work to defend the host against these pathogenic invaders. And as that happens, the body's own immune response kicks in, causing damage to the tissues, resulting in loss of attachment, bone loss, connective tissue loss, because the body is trying to get away from this invader, and in so doing, it actually destroys itself. So it's the body's own immune response that causes destruction that we see in periodontal disease. And it's the bacteria that are triggering this response. And the bacteria are highly organized. They are known as biofilms, which is bacteria growing in a wet environment. Dr. Costerton was the pioneer researcher at the Center of Biofilm Research in Bozeman, Montana. So he termed biofilms and researched them thoroughly. You may have seen the schematic of a biofilm colony in the making. So on the left side of the screen here, you see single-celled planktonic bacteria. As they communicate with each other, they grow this biofilm colony. And as the colony matures, then there's a mucopolysaccharide matrix around the margins protecting this colony. So at this point, if you use any arrestin or any other chemicals, they're not going to be effective because this mucopolysaccharide matrix is in place. And Dr. Costerton termed that goo. So that is the technical name for the protective layer of biofilm. And you can tell I'm a Star Wars fan here. This is the battle for Naboo. And you see the force field on the outside protecting these Gungans against the attack. This is how I visualize this polymucosaccharide matrix, or the goo that protects the biofilm colony. So unless we break this goo up with ultrasonics and or lasers if possible, we're not going to be effective at really doing something to help this patient heal from this chronic infection. So with our ultrasonics and our hand instruments, we are dealing with the bacteria that has accumulated on the root surface. These pathogens are present in the sulcus, and they actually also invade the gum tissue. So here's the pathogen being incorporated into the host tissue wall, and as this pathogen enters, it actually will reproduce within the tissue wall, and causing pain and destruction and a lot of other events that it triggers. So there's a twofold host inflammatory response. We see the localized bacteremia that occurs from the presence of the pathogens, but the bacteria also trigger a cascading series of events that affect the entire body, with the immune system activated, sending inflammatory mediators and cytokines through the bloodstream. So when that is going on, your patients with any bleeding at all have a chronic low-grade inflammation. And as a result of that, there's an overall decrease in immune support. There's an increase in the inflammatory burden on the entire body, and there is irreversible damage caused to the immune system. We know that people with periodontal disease are 40% more likely to have other chronic health conditions. And we know that with even gingivitis, we know that these pathogens are associated with distributing throughout the entire body. This is triggered by the entrance into the tissue wall once these pathogens are in place and established. So it has an effect on the host in all stages. So even in the very early stages of gingivitis, early perio, it has an effect on the immune system of that patient. So Dr. Richard Nagelberg, a wonderful periodontist and researcher, and if you ever have a chance to hear him speak, he's a wonderful speaker, and he talks about gingivitis. I know when I went to hygiene school back in the 70s, we were taught that gingivitis was reversible, that if patients would just get their acts together and start flossing every day, that they could actually turn this around. But we're finding that this, in fact, is not the case. We know that very shallow pocketing will elevate a patient's risk of vascular disease. The more pocketing there is, of course, the more disease present, the greater the risk. But even with gingivitis, we see differences in what happens on a vascular level with the patients. In this photo here, you see a pretty shallow pocket. You see there's some slight inflammation there, but overall the tissue doesn't look too bad. It looks like the patient's doing a pretty good job cleaning their teeth. And yet when we touch the sulcus lightly with a probe, this is the bleeding that's there. So the tissue that lines the sulcus are the same cells that line your eyelids or the inside of your nose. And if you were to apply eyeliner or touch your nose and started bleeding spontaneously, you'd be pretty worried about it. And yet we see this bleeding with our patients, and because it's so common, we're not as concerned. This patient has pretty healthy looking tissue. The pocket depths were through 3s and 2s. You see the mesial of number 2 there. There's some inflammation. That was actually a 4-millimeter pocket. And this is what the tissue looked like just from gently passing a periodontal probe through the sulcus, doing a tissue response. So this is not after scaling. This is just after touching the tissue lightly. So at the JP Institute, our motto is that healthy gums don't bleed, and we need to do everything possible to eliminate, and if not, to hugely reduce bleeding. With certain medications and health issues, it may be a challenge to get people to have no bleeding, but we must do our best. Because when there's any bleeding at all, the pathogens are entering the circulatory system, and they are causing this, again, cascading series of events that trigger other diseases. With nutrition, we may not be nutritionists, but we can have a common sense dialogue with our patients about how they need to eat a lot of fruits and vegetables, especially vegetables. If they're not getting enough antioxidants in their diet, then their immune system is going to be compromised. And when you look at the statistics, only 0.9% of adolescents meet the RDA for the nutrients that they need, 2.2% of adult men and 3.5% of adult women. So people are not eating the right foods. We need to have 9 to 13 servings of fruits and vegetables every day. So who does that? You've got to have a plan for that, and you really need to make sure that you are able to have some of these items in your diet with every meal that you have, including snacks in between. So the ideal diet is a plant-based diet that's 70% vegetables. Too much fruit causes inflammation because of the sugar that's produced. So we need to kind of have that in balance. And whatever animal products are being consumed, whatever non-vegetable, not plant foods that are being consumed should be healthy and free of chemicals. So as we're treating our patients, we want to provide them with natural products that are going to help them heal, help them be comfortable, reduce the pathogens, and there are challenges there. I know for all my career, until recently, I was using chlorhexidine for a subgingival irrigation, and also for full mouth disinfection. We give our patients chlorhexidine rinses to use at home. We now know that the chlorhexidine actually retards healing. It interferes with the fibroblasts and the osteoblasts. It causes cell death. So it reduces the healing response. It increases oxidative stress. And studies that came out last year actually show that rinsing with chlorhexidine twice a day can increase a patient's blood pressure by up to 3 points. And that can be really significant in our patients, with some of them, right? We also know about the staining of the teeth. It changes the sense of the taste, so they have this metallic taste. Overall, it's just not the best product. In fact, can be harmful to our patients. So our challenge is to find something that's going to be effective, that tastes good, that kills bacteria, but does not do harm. And we have to address pain for our patients and how we can reduce that. So I have discovered Stella Life products, and once I started using these products in my own practice, I became so excited about it that I really want to get the word out so that everybody can have this for their patients. These are botanical and homeopathic ingredients that actually relieve pain, they promote wellness, they accelerate healing, and they're very helpful for reducing pain and helping a patient to get that bacteria count down. Very effective as an antimicrobial. These products, they're gels and rinses and products to be used before, during, and after surgical procedures, but they're wonderful for dry mouth. I haven't found anything as effective for dry mouth as the Stella Life rinses and gels, There's an oral hydrating mist that people can use throughout the day. It's wonderful for aphthous ulcers, mucositis, cold sores. Any oral lesions are really relieved immediately as far as the any pain or discomfort the patient has. And when used 3 times a day, these rinses and gels actually will help to quickly eliminate these lesions. With dry sockets and Sjogren's and lichen planus, this is so effective. I've tried treating lichen planus with lasers, and I've had some success, but nothing has been as successful and has given me the same results as using the Stella-Life rinses and gels for these with these conditions. So the products are antimicrobial. They are shown to kill 99% of these oral pathogens. And these pathogens, the anaerobes, are actually reduced for over 3 hours after just one application. These ingredients are FDA approved, and they work synergistically. So the active ingredients put together have this wonderful result of decreasing the swelling and the bruising. And because of that, when a patient uses these products before a surgical procedure, whether it's scaling and root planing or an extraction or grafting or implant placement, when the surgeon or the hygienist does the procedure, there'll be less bleeding because of these homeopathic ingredients and essential oils from the plants that are in there. And then afterwards, they're not going to have the same swelling and bruising, so there's less pain. These are powerful anti-inflammatories and wonderful antimicrobials, and it can be used for any surgical procedure, also with orthodontics. If a patient's having traditional braces or Invisalign, that's controlled inflammation, right? So there's going to be some discomfort, but we're hearing wonderful feedback from our orthodontists who are using the Stella-Life rinses and gels and giving that to their patients. The patients are feeling less pain as they go through their orthodontic treatment. If you have a camera program in your practice, if you're doing a caries infection treatment, then you would use the Stella-Life oral rinse instead of the chlorhexidine to kill the bacteria, and then use your fluorides as you normally would to help with their caries infection. So let's look at some cases. Here's an x-ray. You see this patient has this impacted cuspid, and you can see that on the x-ray and the CT scan. So the patient had that removed, and this is what it looked like at the time of the surgery. You can see it was an extensive procedure. That's got to hurt, right, after the anesthetic wears off. So this patient used the Stella-Life kit, which are 3 products that they begin using 3 times a day, 3 days before the surgery, and it loads their body up with these homeopathic ingredients that will reduce the bleeding and swelling. The patient said that they had no bruising, hardly any swelling, and only needed 3 pills for the pain. And that's really incredible. This is the feedback we get from all our surgeons and their patients. With this patient, they just used the gel on half the mouth after this procedure was done, and you can see the difference 40 minutes after between the side that got the Stella-Life gel and the side that did not. Here's some mucositis lesions that the patient used the recovery kit with the sublingual spray, the gel, and the oral rinse. And after 30 days, you see a reduction. Here's another mucositis patient that has these painful lesions from using an asthma inhaler, and you see the resolutions they got after using the Stella-Life products. Now, let's go ahead and show you this video of Stella-Life in action.
Go ahead, we just finished surgery. Go ahead, apply the gel. Mary, can you open just a little bit more? So this is 40 minutes later. Just coming back, looking at the quality of the tissue. You can see very little inflammation.
Beautiful result from that. Here is the lichen planus case. And again, with lichen planus, it's so challenging. These are very painful. Patients have a lot of dry mouth with this and a lot of bleeding. So this is a wonderful, effective treatment, and I've never seen results like this with lichen planus with anything else. This case was a patient that was trying to remove the alloderm, thinking it didn't belong there, and they thought that they were going to actually lose this graft. So they just had the patient use this rinse and gel, and after 10 days, this is the level of healing that they were able to accomplish. So the graft was not lost after all. If you go to the Stella Life website, then you can actually hear and see testimonials from many clinicians who've used these products and from patients as well, and the benefits that they're getting from them. And then you're going to hear one from Dr. Salcetti and her experience.
I wanted to share my story about using the Stella Life Vega oral care program. I started this about a year ago after the NASP meeting and hearing the testimonials of many of our colleagues around the table. And I thought, in the past, they've never done me wrong in terms of their recommendations, so I thought I would give this a try. And so for the last 9 months, I've incorporated this into my practice. I originally started using just the rinse, very similar to what I had done recommending the chlorhexidine rinse. But then after talking to other colleagues, their recommendation really was to use the entire kit. And so I've been incorporating the gel, the spray, and the rinse for every single one of my surgical procedures. Crown lengthening, ridge augmentation, sinus lifts, gingival grafts, you name it, they get it. And it has been a dramatic improvement in terms of the overall wound healing and, of course, the lack of swelling and pain that my patients have reported to me. In the past, I would see wounds opening up. I would see membranes not only exposed but being lost. I would see bone grafts being lost. And can't say I would always attribute that to the chlorhexidine, but the use of the oral care program has just been really spectacular. And I love the overall wound healing that I'm seeing. And I will tell you, my patients love it as well. They love the fact that there's no staining from what they used to have with the chlorhexidine. They love the fact that there are no bitterness. They love the opportunity that it's a homeopathic rinse and it's plant-based, and so there's no toxins that they're risking putting in their mouths. And they absolutely have not once complained about any issue, that it will help their overall wound healing, swelling, and lack of pain. So I wanted to take this opportunity and share my particular story, and I know many of you all have already been using the Stella Life program in your practices, but I would very much recommend bringing that in and letting your patients enjoy the same wound healing and surgical results that we all want for our patients.
Here's a practice that has been using the Stella Life products, and you can see year to year how they have had a reduction in the need to prescribe these opioids. And there is an opioid epidemic. We've heard about the opioid crisis, and we are actually on the front lines of putting these drugs to the community. We're giving patients these prescriptions, kids with third molar extractions. They may not be using that, and then they're actually getting this out to the schools and selling these pills. I hear about that happening in my own neighborhood. So it's a huge problem, a huge addiction problem, and also the rinses that we've been giving our patients traditionally with the alcohols. It's a really big problem for so many patients, and we don't need to do that. We can use these Stella Life products, which will reduce the pain, and we'll see a significant drop in the prescriptions we're giving our patients. So our goal as clinicians is to educate our patients about the mouth-body connection, how even a little bleeding will shorten that patient's life by 3 to 5 years. That's what the research is showing. We need to create all-encompassing individualized treatment plans based on people's risk factors and provide the most comprehensive treatment plans that are not invasive, that are going to promote the most healing, and talking to our patients about having a healthy lifestyle.